A 40-year-old man presents to your clinic with intermittent non-productive cough for at least 1 year. He knows that his cough is triggered by exposure to perfumes or weather changes. He denies any runny nose, postnasal drip, wheezing, or reflux. Despite attempting nasal steroid spray and oral antihistamines, he experiences no relief. Chest x-ray, normal. Spirometry, normal FEV1, FVC ratio. What is the most likely diagnosis? COPD, GERD, or cough variant asthma? The correct answer is C. The patient presents with chronic cough, which is defined as a cough of at least 3 months. Three most common causes of chronic cough includes cough variant asthma, nasal drip, or GERD. In cough variant asthma, cough is the predominant manifestation, without other typical symptoms of asthma such as shortness of breath and wheezing.